Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority. Welcome to our latest Let's Talk Mental Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. Thank you for joining us. Your mental health is important. By prioritizing your mental and emotional well-being, you'll be able to better manage stress, build greater resilience, maintain healthy relationships, and improve your overall quality of life. So to help you prioritize your mental health, STHS Behavioral hosts these monthly Let's Talk Mental Health webinars. Through this important education, hopefully more people will feel comfortable discussing their own mental health struggles and get professional help if necessary. Now, in this installment, we'll be discussing occupational therapy in mental health. Occupational therapy plays a vital role in mental health treatment. By addressing a patient's physical, psychological, and cognitive requirements, it can help them regain skills and routines, improve social engagement, and enhance overall well-being through meaningful activities and interventions. As part of the treatment team, occupational therapists work to help patients develop, recover, and improve the skills needed for everyday life, including how they act, think, and feel daily. Whether a patient is wrestling with loneliness or battling anxiety, mental health occupational therapy can help them develop coping strategies and self-help skills needed to lead a stable and successful life. So to learn more about occupational therapy as part of mental health, we're joined by Liana Chi, an occupational therapist at STHS Behavioral. Liana, thank you so much for joining us.
Thank you so much for having me, Tom.
Now, when we talk about mental health, we talk about you are not alone. And it is so true because statistics from NAMI say that 1 in 5 U.S. adults will experience a mental illness each year. And 1 in 20 U.S. adults will experience a serious mental health issue each year. And then when we talk about kids, 17% of kids between the ages of 6 and 17 experience a mental health disorder. So mental health issues are very common in this country, right?
Yes.
And here locally, you have been working at STHS Behavioral now since December.
Yes,
so
correct.
I have been really busy, I'm assuming, seeing all of the patient flow that comes into the hospital.
Yeah.
But as an occupational therapist, what are your responsibilities at the hospital?
My responsibilities are to speak with the patients, understand what was their life before, what were their activities, what were their hobbies. I'll touch base on what occupations mean at this time. Occupations in the occupational therapy profession mean that they are meaningful activities, whether that be their role, their hobbies. So this is what I get into and talk with patients first and see how we can get them back into that or finding their new normal.
So a lot of the times when you talk about occupational therapy, you think work and maybe you've suffered an injury and you have to go back to learn how to do some skills or things like that. But occupations in the regard of occupational therapy means just those activities, as you mentioned, just what you're able to do, daily activities to function independently.
Yes.
And now, how do you incorporate, once you learn what their needs are, how do you incorporate it into the overall mental health treatment plan?
Yeah, so as part of the mental health treatment plan, I do provide group therapy as well as I can provide them with the necessary resources. For example, a patient who loved reading would like to continue reading. I could provide them with a story or a book so that while they are with us at Behavioral, they can still continue the occupation. And then same thing in the group setting. If their occupation before was painting, art, they're a very artistic person, I continue that and provide them with some arts and crafts so that we can continue developing those skills and also continuing their commitment to those hobbies.
So what percentage of the time would you say you spend doing occupational therapy with patients? Like a patient, if they wake up in the morning, let's say at 8 and they go to bed at 8 to 10 or whatever the hour may be, about how much percentage time do you spend with them for occupational therapy, would you say?
I believe Probably 75% of their day. If it's not doing their assessment, it's doing group therapy. And if it's not through me, myself, it would be through my activity coordinator team.
And how big is your activity coordinator team? I'm sure it keeps you busy because you do have adolescents that you work with, and then you have teenagers, and then you have adults.
Yes. So my team currently consists of about 5 professionals. They're all activity coordinators, and they implement the group therapy, and I give them suggestions. Of course, part of their treatment plan is finding the strengths of the patient, so I make sure that they emphasize that as well in their therapy groups.
And education is really important, and understanding just how occupational therapy works in the mental health arena is crucial to making sure that patients get all of the support they need.
Yes,
and so you do have a great presentation for us, so let's get started.
Yes. So today let's talk about the impact of occupational therapy on mental health. In my presentation, I'll be going through an overview of these topics here. Occupational therapy, its origins, what an occupational therapist registered does, an occupational therapy assistant does as well, and the domain and process of our scope of practice, and lastly, how occupational therapy is impactful in mental health. So first, what is occupational therapy? When individuals and other people hear of this term, they don't really understand what occupational is. They first start with, oh, is it job related? And of course it is to some extent, but in the term of occupation and occupational therapy, it means the everyday activities that are meaningful and impactful to the individual. This includes their needs, wants, and their expected roles. Therapy means a treatment method of healing, and if you put them together, occupational therapy together is a therapeutic use of occupations to promote participation with individuals, groups, or populations. And what are occupational therapists? They are health professionals that work with individuals of all ages. They help patients live their lives to the fullest, help them gain, regain, and improve the skills needed for their functional independence. Now, the origins of occupational therapy dates all the way back to the 1800s. So at this time, there was an arts and craft movement that inspired health professionals, physicians and nurses and therapists alike, to provide occupation-based activities in engaging minds and the hands of patients. In 1914, the term occupational therapy was then developed through various researches and various methods of this arts and crafts movement. And then in 1915, the Henry B. Fable School of Occupations was established. At this time, an important figure named Eleanor Clark Slagle first organized the educational program for the first occupational therapist. In 1917, civilian women served as occupational therapy reconstruction aides in the military hospitals at home and abroad, providing treatments to World War I soldiers. They worked alongside nurses to improve morale and promote engagement through handicrafts, vocational skills, and physical activity. At this time, the soldiers experienced what is now known as PTSD, but back then as shell shock. They had impairments in reasoning, sleeping, talking, and walking. So from the very beginning, occupational therapy always had a mental health origin. And to this day, although we now work in different settings, not just mental health, but as rehabilitation as well, and nursing homes, and patient settings, but from the very beginning, occupational therapy always had a mental health base. Now, this is a quote by Eleanor Clark Slagle, the mother of occupational therapy. She states, "To help patients to readjust themselves both socially and industrially through organized occupation." And that was the purpose of occupational therapy at that time, and it still rings true to this day. Now, first, let's talk about the different occupational therapy professionals. First, we have the registered occupational therapist. Their roles and responsibilities include evaluate patients' strengths and deficits, create achievable goals, develop a treatment plan, implementation and enforcement of that plan, the treatment of patients through interventions. They collaborate with the team and promote occupational participation. The education needed to become an occupational therapist includes a high school degree or a GED, undergraduate degree with prerequisites fulfilled, 2 to 3 years of a graduate education, this could be a master's or doctorate in occupational therapy, passing the NBCOT certification exam, and fulfilling state licensure requirements. Now, in reference to an evaluation of what kind of is in the mind of an occupational therapy, I like to use this example. Imagine the board game Candyland. To us, it's a very basic, no thinking much, board game. But to an occupational therapist, there's more to it. So let's say you're working with a patient. What are you exactly evaluating? We're understanding if they can follow instructions, if they know their colors, can they take turns, can they wait their turn, can they also wait and be patient in their chair. There's so many things that we account when it comes to evaluating a patient. And based on what we see and how the patient may be interacting with us, interacting with others, and interacting with the environment, that's how we develop the treatment plan, and that's how we create achievable goals. For example, if they don't know their colors, then what is the next goal? Well, in about 3 weeks, we want them to identify at least 3 colors. So through that goal is where we develop treatments and how interventions, so single sessions and how we can reach that goal. So that's kind of an example of what's in the mind of an occupational therapist and how they evaluate their patients, develop their treatment plan, and enforce it. Moving forward with the certified occupational therapy assistant, their roles and responsibilities include, under the supervision of the OTR, implementation of the treatment plan, treatment of patients, collaboration with the team, and promote occupational participation. The education needed to become a COTA is high school degree, GED, prerequisites for the COTA program, 2 years of this program at the college level, passing the NBC OT certification exam, and fulfilling state licensure requirements. COTAs or quotas are also a very integral part of the occupational therapy team. They provide their OTRs with feedback. If they see that their patients can improve in this certain area or this certain goal, they're more than welcome to provide that feedback and put their input into the treatment plan as well, and to overall just give the best care possible to the patients and reaching their goals. In occupational therapy, we highlight that small wins equal big victories. So whether through these small sessions or small treatment sessions we have with the patients, it is all big. They're all small victories to leading to achieve their goals in the end, and overall improving, again, their occupational participation and their overall well-being. So now let's talk about the scope of practice, or the domain. So this is what the foundation of occupational therapy is. The domain, of course, is the focus on the promotion of one's participation in their occupations. Occupational therapists, they help clients participate in their occupations, whether that be roles, contexts, life situations. And then these participation in these occupations are often emotional, psychosocial, cognitive, and physical. We help them in enhancing their health, well-being, and life satisfaction. The occupations are the meaningful activities that we help our patients with in improving their participation. Our ADLs, or activities of daily living. This includes brushing your teeth, grooming yourself, making sure you're able to feed. That's an integral part of who we are as individuals, even though we may not think of this. To many of us, it's second nature, but ADLs are so important. And it's the core of who we are as humans and as individuals. IDLs are instrumental activities of daily living. These are an extension of your ADL. So for example, if an IADL is money management, are you able to access your bank? Can you write a check? Can you manage your own medication? Can you do your own laundry? Can you do your own grocery shopping? So again, it's many of the things that we don't really think much of or take a second to think much of, because they're part of who we are, and that, again, that's who we are as a core of who our identity is. Next is health management. I did touch base on that. That's kind of like, are you able to manage your medications? Are you able to continue on and follow up with your treatment plans? Overall, just being diligent when it comes to your health and well-being. Rest and sleep, another occupation we don't really think about, but is very integral, because if we don't have a good night's sleep, how is our mood the next day? Not very productive. So rest and sleep, again, is a very important occupation. Next is education. Education, to many of us, is also an integral part. There are people who identify as students, as teachers or lifelong learners. Education is also an integral part of who we are and is an important occupation. Next is work. A lot of us have jobs that are very meaningful to us, and they really define who we are and what we do. A lot of us love what we do and make it our identity. And so that's part of what work as an occupation is as well. Next is play. So whether that be a work-life balance, and whether if you're a child, play is also a very important part of your identity as well. Leisure, similarly so. And lastly, social participation. With all of these occupations together, you get a very well-rounded idea of an individual, who they are. So when I complete my assessments in the hospital, I ask questions that are aligned with understanding what their occupations are and who they are as a person and what is meaningful to them. And that in its core is, again, truly who a person is through their identity and what makes their life so purposeful. Next is the process. So how do we deliver OT services? This is through evaluation, intervention, and targeting of outcomes. Through evaluation, we understand the environmental and personal factors and performance patterns that a patient has, and are we able to analyze if they're able to carry out their occupations, their meaningful activities. Through this evaluation, we identify any needs they may have, any deficits, what their strong suits or their strengths, and any barriers that are affecting their occupational participation. An example of this, again, if I touched base from earlier, was if a patient says that they used to love reading, but in recent times they have lost motivation due to their anxiety or symptoms similar to anxiety, how can I get them back to reading again? So through there, as a mind of an OT, I try to connect the dots. Even on assessment or evaluation alone, I'm able to kind of understand and how we can provide that for them at the facility. Now, intervention is the actual planning and implementation of treatment services. This includes education, training, advocacy through individual or group interventions and virtual interventions. In the behavioral facility, we work with a lot of group interventions through group therapy. It's very important. Again, through the mind of the OT, this is what's going through my head during group therapy. I see a patient, I focus on them. Are they interacting with their peers? Are they following the instructions given to them by the facilitating therapist? Are they able to share their feelings regarding the group intervention at that time? And are they complying? There's so many things that we take into account as of the individual and how they're behaving and reacting during their group interventions. And lastly, the outcomes include achieving health, well-being, and engagement in occupations. As occupational therapists, we help patients learn or relearn the skills necessary to live life to the fullest. Whatever their new normal may be, or whether that be finding a new normal, we really help them little by little live their life to the fullest. Now let's touch base on occupational therapy and why it's so important in mental health. As stated earlier, occupational therapy does have roots in mental health and does continue to carry on its origins to this day. During patient treatment in the behavioral hospital, again, occupational therapists are an integral part of the treatment team. We help assess patients, their motivation, and their engagement of occupations. We help patients in developing, recovering, and improving the necessary skills to participate in their occupations. As occupational therapists, we're only the start of their journey at the behavioral hospital. We provide them with tools that they can add to their toolkits, and these include learning coping skills to manage their symptoms, improving social participation in their relationships, and even helping them find new occupations or activities that bring them joy. As occupational therapists, we only plant the seeds to help our patients flourish in their mental health journey moving forward. Again, small wins equal big victories. Lastly, I'll end my presentation with a quote. Life takes on meaning in the minute-by-minute reality in which we experience ourselves achieving ordinary things. And this quote is by Gary Kilhoffner, OTR. And that is my presentation.
That is all really great information, and I like your example of the Candyland board game, because we've all played Candyland growing up, whether we loved it or our sister or whoever it was, but it's a game that we all understand. And as an occupational therapist, I can only imagine that you're sitting in a room full of people and you're like, okay, this person I can help with being able to better follow instructions. This person I can better help with knowing how to take turns properly and play fairly. And so when it comes to that, what are some of the common issues? I mean, if you're thinking about, as you bring patients in and you're thinking about it, what are some of the common deficits that you see or issues that you see? Is it following instructions? Is it taking turns? Or is it really some of the simple things of not identifying colors, which can be a real challenge?
So at the behavioral setting, a lot of the common issues I see for patients is that lack of motivation, or the loss of motivation, actually.
Okay.
So how can I help them regain that spark? Sometimes reintroducing them to the occupation, whether printing them out a story so they can get back into reading, kind of ignites that spark little by little. And that's how I help them in that setting.
Finding your spark is so important.
Yes.
You have to have that motivation and that passion, and it can wane and it can ebb and flow, but you have to just keep that spark alive. So I know when you're dealing with depression or anxiety or PTSD or one of those issues, that spark can definitely dim, but you make your every effort to bring it back to life.
For sure.
Now, when you talked about the activities of daily living, so brushing your hair, simple tasks like that we kind of take for granted, and the instrumental activities, what are some of the things that we need to know about how a mental health condition or a challenge may impact our ADLs? It's again that loss of motivation,
yes,
or
for sure.
like with, let's say for instance, depression. How does that impact our ability to do all of those daily living activities?
Yes. So touching base back to the loss of motivation, a lot of people just don't have the energy or find that there's a need to do these things. But the truth is, again, it's helping them finding that spark again and motivating them to get back into it, because self-care is very important. If you do take care of yourself, and we again continue to promote that with them, they kind of feel better about themselves again and slowly feeling good again and finding that spark too.
Now, what are some of the common barriers that affect your patients' occupational participation? You go and you sit and you have a treatment plan with them. You want them to do groups or individual activities. So you have a plan in place. So what are some of the barriers that you encounter?
Yes. So a lot of times the patients that I encounter in the hospital, they have a big life change, that they're still getting used to, whether that be a loss of a job or a loss of a person that's important in their life. So they're getting used to that change. And so we're going to help them try to maneuver through this difficult period, and try to get them back to feeling like themselves again. Yes.
Now, when it comes to mental health challenges, obviously people can find themselves unable to work, attend school, or even enjoy hobbies and sports. The world sort of becomes smaller, and you sort of start isolating yourself, which can happen. Like they say that the two enemies are your bed and your sofa, because your bed, you don't want to leave it, and the sofa, if you do leave it, you stay on the sofa in front of a TV, let's say. So why is isolation so dangerous?
Isolation is dangerous because they are straying away from who they were, before their depression, before their anxiety. Who they were as a person was someone they felt fulfilled and purposeful. So if they were to take themselves out of the equation and isolate, they're no longer interacting with loved ones or doing the things they used to do before. And so it's kind of like not who they are. They're really not who they are anymore, and we want to try to avoid that and continue promotion of occupations and everything, and whether that be little by little, because it takes it's little by little, step by step, to get them back to who they really are. But isolation, of course, sometimes can be inevitable, but we do what we can to help them.
So what advice do you have for someone who may be experiencing that isolation? Maybe they lost a loved one, they're going through a little bit of grief and loss, or they've lost a job and they're starting to feel themselves isolating. What advice do you have for them to kind of try to break that cycle and get back out?
My advice is that, for sure, feel everything you need to feel, and know that there are people willing and wanting to help you, whether that be your friends or your loved ones or health professions. They're always going to be there, and feel everything you need to feel, and slowly but surely try to engage in your occupations again and start to feel like yourself again, of course, when you're ready. And know that all of us are able to help you as well. And
even if you can just get outside for 5 minutes, that sunlight can do a world of good for a person. And it's just, as you mentioned, those baby steps. So just, hey, if I can just open the door and go check the mail today, then tomorrow maybe I can walk around the block, and then maybe I can do a couple of laps around the block, and just slowly try to break that cycle, right?
For sure, yes.
And that's, I assume, when as an occupational therapist, that's sort of the way you're developing goals for them. So you're saying, for today, I want you to do this. By tomorrow, we want you to try to be here, and kind of that way, because the one thing you don't want is to set a high goal that's unrealistic, and then they feel even worse about not meeting that goal.
Yeah, one of the things I do ask my patients when I speak with them is, what are your goals? What is something that you are looking forward to? And they get so excited, they light up and say, oh, I want to achieve my GED. Oh, I want to own my own business. And they get so excited, but I understand that amongst that excitedness, there's well, how do I get there? I emphasize to them, that's an amazing goal, but it'll take some time, and we're here to guide you, and trust yourself in the process as well. And getting there is not linear. For sure. Yeah.
Now, work and school obviously give us structure and a sense of purpose and belonging, but it can be impacted if we're sort of facing a mental health challenge. So how do you work with your patients to get them back to work and school?
So oftentimes when I do my assessments, I ask what their occupations were, or I ask what they want to achieve in the future. For example, if a adolescent patient were to ask, oh, I want to become a nurse, I say, okay, well, here's what I can do. I can print you out on how to become a nurse and learning more about the profession too, and have them plant that seed and have them read that during their time here and time in the facility, and see if that's something they want to pursue. And if they do, I encourage them, okay, when you get back to school, please talk to your counselor and tell them that this is the route you want to pursue, this is the school you want to go to, and see how we can make that happen for you.
Now, we hear a lot about work-life balance. It's something that has been around maybe about a decade or so, where people have really talked a lot about it. So how important is it to have that balance, especially for a workaholic like myself? Like, why is it so important to have that work-life balance?
It is so important, because if you focus all of your energy on work, then you're burnt out. If you focus so much more on leisure or play, then where's the work? So it's important to have that balance, not just for your own health, but as your productivity as well, through work, and then the time and effort you can give through friends as well. So it's important to have that balance.
So as an occupational therapist, do you work with your patients on getting that balance and in check, especially if you have somebody who is completely off kilter when it comes to one or the other?
Yes, as occupational therapists, we help with that, and a lot of problem solving skills as well when it comes to their mental health, just to, you know, find that balance and find their purpose again in that sense.
What are some of the strategies that you use when it comes to work-life balance and getting them kind of a little bit more centered?
Yeah, so sometimes I take a little bit of time during my assessment if needed, if I could sit down with them and say, okay, so how much time do you dedicate in work? And how much time do you dedicate in your hobbies? And then I try to visualize their day schedule with them. And oftentimes, a lot of patients say they prioritize a lot of work, you know. So that's really important, because without addressing that issue, it leads to a lot of mental health issues and a lot of mental health fallbacks. So it's important to have that balance, and that's how I emphasize it with them.
I went to a session one time that STHS Behavioral was leading for teachers, and they did this clock. So it was basically like a color activity where they had a clock and they asked you to color in your hours for sleep, your hours for work, and your hours for personal time. And so that people really got an idea of how much time they spend in each. And you realize that there were a lot of people that just didn't have any of the blue color, which was the color that was for things for just yourself.
Yeah.
You know, and so having those activities for self-care, those kind of things. And so an activity like that is very beneficial, isn't it? Just so you can visualize and see, look, this is how much time you're spending doing A, B, C, and D.
Yes, that is a very excellent method. We usually think about our patients when it comes to work-life balance, but what about ourselves as professionals? You know, we have to practice what we preach and also have that work-life balance so we can give the best possible care we can to our patients too.
Now, when it comes to sort of the aspects of your approach to therapy, right? So you'll have practical skill development. Tell us, what are those practical skills and how you're helping them develop them?
Practical skills. So for example, if a person were to say, going back to the topic about a nurse, so a lot of what a nurse does is problem solving or structuring their day or structuring tasks. So I sometimes, again, if I have time after my assessments or in between group sessions and a patient wants to work on those skills, I give them worksheets, or I sit down with them and say, this is how you can develop these skills, and that's how they can lead them to those practical skills and becoming a nurse. Yeah.
And then you have self-management integration. So managing yourself and being able to manage your time and all of that. So how do you handle that part? Yeah,
so self-awareness is important. Through the assessment I do alone, a lot of patients are stumped because they're not usually thinking about what they do, and they're not usually they're not usually used to being self-aware. So a lot of the self-management comes from that awareness, and we try to promote that and understand that, you know, as much as, you know, there is support for you, it is important that you also self-manage yourself and also go through this journey with yourself rather than depending on so many people.
And then there's obviously specialized treatment. So that'll be if there's something. And I think the beauty of understanding the mental health arena is that, yes, you do group activities, you have group therapy, things like that, but everyone has an individual plan. No two plans are the same.
Yes. Everyone really is unique, and although we may have there may be similar diagnosis or similar symptoms, we try to make sure that each person's individualized needs are met through occupational therapy.
Now, when we talk about sort of your assessment, so there are different key components, I assume, that you have to do when it comes to the assessment. So you're looking at the cognitive assessment. So tell us what you're looking at in that regard.
So in my assessment, I generally ask simple questions in terms of, what were your hobbies before? What did you like to do for fun? And people would usually answer what they like to do for fun, and if not, you know, some people say, oh, I don't do anything anymore. So even though those answers are very simple, and I really take into account, okay, where is that motivation? If they say they don't have any more hobbies, that means there's a lack of a motivation. I also assess, you know, to see if they're coherent and if they're able to verbalize to me and provide me with coherent thoughts and coherent speech. So it's a lot of, again, it's reminding me of Candyland, where even though I asked just simple questions about who they were, what they like to do, it's a lot of thinking.
You're able to gauge a lot out of that in terms of how their cognitive process works. Like
Yes.
if they're able to process properly.
My questions,
And
yes.
And then a functional assessment, what would that be? Is that like the daily functions of life?
Yes, yeah. So in a behavioral setting, it's just, are they able to complete their ADLs? Most of the time, a lot of patients are independent in the behavioral setting, but we do have a few sometimes total patients or total patients that do need that assistance. So I try to see how we can assist them in that sense.
And then there's sensory profiling. What would that be?
So sensory profiling, again, is kind of the candy line when it comes to evaluation, is understanding their roles, their needs, their strengths, and their barriers to their actual participation in their occupations.
Now we talked about work-life balance again. So when we're helping people sort of get that work-life balance, why is it so important to identify stressors?
Well, stressors are important because the stressors is what causes that unproductivity, and how we need to know that in order to be able to overcome it as occupational therapists. And as you know, we can help them overcome that. Yes.
Now you touched on the toolkit, and I always talk about how it's so important to have a self-care toolkit, like having those sort of strategies that will help you when life gets a little bit rough. And so what are some of the, when it comes to skill building for resilience, we talk about coping mechanisms, or what are some great coping mechanisms that you recommend for patients typically?
I really recommend mindfulness. You know, in the midst of the stress or the busy day, just take some time to yourself. Close your eyes if needed, take a few deep breaths. I know it's kind of hard, you know, you're always on a time crunch with work, but take that time to yourself. Self-care is wealth. Health is wealth. So it's important to take that time with yourself when it comes to mindfulness.
Now, when we talk about resilience training, how do you train someone to be resilient?
Sometimes when it comes to resilience training, it's just a matter of, for example, when it comes to groups, not everyone is accustomed to groups. Some people may have anxiety and would like to stay far from the group therapy sessions. But I encourage them, you know, small wins equals big victories. So just slowly integrate yourself, maybe even just for a few minutes, and you can step out. But just know that group therapy is always going to be there should you want to participate in it.
And you also do routine modification. So you may be doing something that isn't necessarily helping you in the best way possible. So you have to sort of make those modifications for your ADLs or whatever they may be. But there may be something that's causing you to unfortunately not be leading your best life, right?
Yeah, so a lot of patients too they go through substance abuse. So a majority of their day is the usage of substances, which is not productive when it comes to their roles as a worker or a student. So how can we change that and rebuild that through habit replacement? So what is a good, healthy activity that you like to do, or hobby or occupation that we can replace with that, so that your life can be and your roles can be more fulfilled and productive.
And then one of the keys that I think people don't realize how important it is obviously boundary setting. And learning how to set boundaries, especially when it comes to your mental health. How do you help people understand the importance of setting boundaries?
So in terms of setting boundaries, it is very important, because sometimes there are influences, or like friends or bad influence through family, that could be the reason why you experience a lot of mental health stressors. So understand that although your role in my life is to be my father or my mother or my friend, understand that this is a certain time that I need for myself, and I'm going through this period of healing. It's important so that they can give back some time to themselves.
And obviously, when it comes to occupational therapy, it's part of obviously the overall approach. But when we talk about a holistic approach, what does that mean?
Holistic is it encompasses the overall well-being of a person. So it's not just the physical, but also the mental, social, and spiritual in all aspects. You know, that is what holistic means in the occupational therapy profession. And
when we talk about the benefits of occupational therapy and mental health, so improve social engagement. That's really important. You need to be able to be in a crowd at work, or a work function you need to attend. Being able to socialize is really important.
Yes, we really do encourage our patients, although not all group therapy sessions are mandatory. We do, again, encourage them, you know, if you could find some little bit of time, just step here for a second and do this activity. activity, interact with some people, because it does overall help with their mental health.
And then you help reduce social isolation, which is one of I think the enemies of mental health is isolation.
Yes, isolation. So again, we reiterate the importance that there are people here to help you, whether it's your support system or health professionals. And again, getting back into the things they love doing little by little.
Now you help enhance the ability to manage stress and emotions, and managing our emotions can be really difficult, especially if we don't have that work-life balance and we haven't mastered our self-care strategies, right?
Yes, yes. So a few of our patients, have anger management issues. So a lot of times, instead of productively reacting to a situation that, that is not to their liking, they react unproductively and cause a lot of people and themselves a lot of emotional harm. So it is important that we emphasize that. Yeah.
And then you also help increase medication adherence. And I think that's one thing that people think, no, I'm feeling better, I don't need my meds anymore. And if you're not adhering to them as prescribed and you're not following the protocol, then you are only going to, at some point, relapse or have an issue.
Yeah, so a lot of patients that do get readmitted often, it is due to medicine mismanagement. So they don't continue taking the medications, or they think, oh yes, I'm fine, I don't need it. But it is important, especially for mental health, to manage those symptoms and risk getting back to relapse or getting through another mental health crisis in that sense.
And then you help improve community reintegration. So obviously they have been in a crisis mode, they're in the hospital setting, but you want to make sure that they reintegrate in a proper way, in a healthy way.
Yeah, so we work closely with the treatment team that includes the doctor, nurse practitioners, nurses, and therapists alike, so that we continue to make sure that they have a proper placement so that they get away from their stressor, whether that be substance abuse or influences, so that they have healthier housing and healthier living in that sense.
And ultimately, you really just want them to have an improved daily life.
Yes.
Ultimately,
yes.
that's the key goal.
For
so
sure.
let's talk about self-care strategies and why self-care is so important. What are some of your favorite self-care strategies? What are some of the things that you love to do that you think someone else may appreciate?
So I really like spending time to myself. I live with my family, and sometimes it can get so hectic. So after work, I just unwind and step away for a second, and then once I'm ready and I felt that I found that time to de-stress, I come out for dinner, like, hey, how is everyone doing? So taking that time to myself is self-care for me.
But then I personally love the adult coloring books.
Oh yeah,
and
those
being
are
able
good
to just
too.
do those. But it's really like looking up, doing research, looking at the things, but finding something that allows you to just decompress, unwind, and relax and take a moment for yourself.
Yes, for me, so a specific activity when it comes to that is walks. I love nature walks and just being out in the sun, hearing the birds sing, and also just seeing beautiful scenery is self-care to me too.
And that's another relaxation and stress reduction technique. So that's another one where you can it's a double whammy.
Yes.
You get the self-care, but you also get the relaxation. What are some relaxation and stress reduction techniques that you think are good for people to know?
Yes, so in group therapy, I really emphasize the 5 senses. So whether that's touch, taste, hearing, sight, or smelling. So I emphasize to patients that these 5 senses are here for you through your coping strategies. So let's say you're going through a stressful moment and you take a walk outside. You just hear your senses, hear, smell, taste, everything, and just be in that moment with those senses.
And I know when someone is having sort of a panic attack, they'll tell them, tell me 3 things you can hear right now.
Those
I hear
are
birds, I hear
grounding,
cars, I hear. So it'll help ground you, right?
Yes, those are grounded techniques for sure to help with that, yes.
And coping strategies, what exactly are coping strategies?
Coping strategies, touching back to what we mentioned earlier, it's a lot of dealing with stressful situations more productively. So whether that be taking yourself out of the situation, like stepping away and setting boundaries, or taking time to address it in a more productive manner rather than being angry or reactive. So it's just going back to that, yes.
And emotion regulation, like we all have those moments. We hear about road rage incidents. We hear about, people sort of having shouting matches, things like that. So how do you help somebody basically regulate their emotions? What are some of the key techniques that you use for that?
If it's not through grounding techniques, it's a lot of the mindset as well, the compassion that we all should have for each other, not just occupational therapists to patient, but as everybody in this world, understanding that if it's road rage, maybe this person was just going through a rough day and they had to rush through work. It's just having a little bit of compassion for others and for yourselves is for me what coping skills are.
Yeah, we always hear about having some grace.
Yes.
Give yourself grace and give others grace as well.
Yes.
You don't know what they're going through. You really don't understand what they are unless they officially tell you. So
yes.
Yeah. And then social skills and communication. So you're going to help a patient sort of develop some of those social skills that maybe they didn't have before they started experiencing those mental health challenges, and stress the importance of communication, right?
Yes, I think that's what's really one of the biggest highlights when it comes to group therapy is that interacting with peers and ensuring that there is no risk for isolation, or just continuing back into that social participation when it comes to occupations.
So what are some of the telltale signs that you will see in a patient when they come and you're getting ready to assess them? What are the telltale signs that they may need some occupational therapy?
For occupational therapy, let's see, I can tell that they are not, if they don't engage in their occupations as they used to. There's clearly a big need and gap when it comes to that. So that's how I can tell off the bat if they're not able to answer my questions, or they can say, oh, I don't have any more hobbies. That's the telltale sign that I see.
So what is your final piece of advice for somebody who may be struggling mentally and they may start seeing that their occupations are declining? What would you want to tell them?
I would want to tell them that their occupations are always there for them. I know this is a really tough period that they may be going through, but those are things that help you feel spark and joy at one point. And know that you can always re-engage with them when you're ready and with the right support.
Take the baby steps and find your spark.
Yes, take the baby steps and they become big victories.
All right. Well, thank you so much, Liana. We really appreciate your time, and we hope we can get you back here again another day.
Thank you for having me, Tom.
All right. And that officially concludes our webinar. We thank you for watching. We hope you'll continue to prioritize your mental health and the mental health of your loved ones. If you are experiencing mental health challenges, STHS Behavioral can help. The facility has served the South Texas community for more than 30 years, offering inpatient and outpatient treatment options. If you or a loved one is experiencing a mental health issue, you can schedule a confidential assessment by calling our hotline at 388-1300. Now, please remember, you are not alone. Speak with a loved one or seek professional help if you need emotional or mental health support. And if you are experiencing a mental health crisis, please call the National Suicide and Crisis Line at 988. Licensed counselors are available to speak with you in English and Spanish 24 hours a day, 7 days a week. Now, don't miss the next installment of this Let's Talk Mental Health series on Thursday, May 1st at 5:30 p.m. live via Facebook, when we'll discuss the impact of mental health on your well-being. We hope you can join us, and to watch our previous Let's Talk Mental Health webinars, all you have to do is visit sthsletstalk.com. Until our next webinar, stay healthy, stay safe, and please continue to prioritize your mental well-being. Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority.